Plyometrics is great for core strengthening. It's great for conditioning, and it's really good when you have a stiff hand that's starting to resolve. Remember, with plyometrics, it's deceleration and acceleration. So the faster you go, the more benefit you're going to get. This is just using a 2-pound ball that I really like. Sometimes they're called medicine balls. Sometimes they're just a 2-pound ball that you calm. And again, plyometrics is the faster you get rid of it, acceleration and deceleration. This is one way you can do it. Another way is trying to do this. You might start out slow like this, but try to encourage your patient to go faster. Other ways, juggling is good. And remember, the faster acceleration, deceleration, don't let those muscles rest. You'll do well. Okay, now let's look at motor imagery. I talked a little bit about this earlier. Motor imagery is fascinating. It has been well proven that the mirror or motor imagery will help with performing an activity or to decrease pain. An example, you've seen this with phantom limb pain. Okay, somebody has an amputated finger and they have phantom limb pain. What do? We take the electrode and we put it on the contralateral or the opposite hand on the same finger that would simulate that amputated finger, or the same finger on the opposite hand, and we get results. So motor imagery is proven, helps with the cortex and helps with increasing range of motion, decreasing pain. So in that, you use a mirror to view healthy limb and reflection of the same limb. So you put the stiff hand in the box, the sound hand is going to be outside the box, and then you concentrate really hard on the images as if both limbs were normal. And if you look at this is a photo of the stiff hand in the box, the sound arm out, and it tricks the brain into correcting its distorted image of the body. Pain will become less. The brain will perceive the body and the actual coordination of the body by looking at this mirror. So when you trick the brain into thinking that the limb is actually better than it is, the brain will actually think it is. And it has been well proven that you can increase motion, you can decrease pain, decrease edema, and so forth using motor imagery programming. We have a fantastic course on this called Mirror Mirror by Susan Straka, and I highly encourage you to look into this course because you will really benefit from it.